My name is Roberto. I'm from Barcelona, Spain, and here I'm working in UAE as a personal trainer. For the past 2 years, I'm feeling pain on my ear, so I was trying to delay the treatment or visiting the doctor because I thought that will go away. So basically, the pain was going and coming, going and coming. The pain was going even down, not only in the ear, going down. Then they reached the point that I felt that went out of control. So I decided to visit the doctor and check what is going on. So one of my friends recommended me to come to Canadian Hospital. He said that it's a very good hospital and always he comes here to check and he's very happy with how they treat him and everything. So I decided to come here and give a shot, and yeah, it was true. It was very nice. I came to the hospital, to the emergency room, to check my ear because it was hurting a lot. Then they decided to send me to the ENT. Since the beginning, everyone was treating me very nice and the environment was very friendly. So that made me feel that this is not a hospital, because sometimes the people think, oh, if I go to a hospital, it's just something will happen or something bad. Always people is scared. So here I felt that it was something different.
Hi, I'm Dr. Haitham Morsi. I'm an otolaryngologist and head and neck surgeon working at the Canadian Specialist Hospital in Dubai for the past 2 years. I hold a master's and a doctorate degrees in otolaryngology, head and neck surgery from Alexandria School of Medicine in Egypt. I have more than 15 years of experience and my special interest is rhinology and anterior skull-base surgery. Mr. Roberto visited us at the Canadian Specialist Hospital with the chief complaint of bilateral ear fullness, ear pain, and hearing loss on and off for the past couple of years. He was also complaining of bilateral nasal obstruction, mouth breathing, facial heaviness, snoring, and disturbed sleeping pattern for several years. He works as a personal trainer, and the breathing difficulty causes him a lot of trouble during his workouts. When I examined his ears, I found both drums are dull looking with 2 retraction pockets and fluid in the middle ear, which denotes that there is a problem in the eustachian tube. And sometimes we call this situation blue ear. Upon examination of the nasal cavity endoscopically, I found that he had a severely deviated septum, bilateral inferior turbinous hypertrophy, and the huge nasopharyngeal adenoid blocking the nasal airway. I was discussing the case with Mr. Roberto, and I explained to him that most of his ear problems are due to the nasal pathology. So I asked for a CT scan ear and nose to rule out sinusitis and middle ear problem besides effusion. I advised him to take medication for about a month and a half, aiming for the middle ear fluid to resolve, and we'll follow up the improvement via tympanometry, which measures the middle ear pressure. Unfortunately, he didn't respond to medical treatment, so he underwent bilateral endoscopic myringotomy with grommet tube insertion for his ear problem. And he underwent endoscopic assisted septoplasty, bilateral turbinoplasty, and coblation adenoidectomy to relieve the nasal obstruction. He recovered peacefully from anesthesia without any complications. He's hearing well, breathing well, and he never felt better.
So after this, we continued doing follow-ups, but honestly, it changed my life. Completely changed my life because I didn't realize that I was having problems and troubles breathing. During my workout, during my day, every day. I didn't realize until he told me and I got the surgery. Like now it's another thing, it's completely different. I breathe better, I sleep better. When I train, I feel that I can go more thanks to this problem that he found out. So I'm really happy and I really appreciate what Dr. Haitham did at the Canadian Hospital.
Canadian Specialist Hospital, Abu Hail, Dubai. Visit www.csh.ae